brand new episode of Private Parts with me, Liv Bentley. This is the podcast where nothing is off limits. Don't forget to like, subscribe, and follow us wherever it is that you get your podcasts. And you can also watch every glorious episode on our YouTube, which is at Private Parts Pod. This week, we have got a returning guest who is, we all need to say thanks to, for sorting out my face and my teeth. It's Dr. Sam. Woo!
Thank you for having me back.
Firstly, welcome back. Secondly, I have had so many messages about my mouth. People think I've had a facelift, which I don't know if that's rude or not, to be honest, but it's very sweet. No, people have honestly said that I look younger, and I think it's down to my lashes.
I agree.
No, so Dr. Sam came in, and then I, got swayed with everything you were saying, came to you to have my teeth done. But more on it, actually, not just a cosmetic level, though.
Yes. So I think, ultimately, let's talk about why you even were considering cosmetic dentistry, right? Because on the way in, you were telling me that it was never on your mind anyway. But then I think once we spoke last time and you were having kind of Invisalign somewhere else and all that sort of stuff, the things that people don't realize is the power of cosmetic dentistry in terms of what it can do for your face. And a lot of people end up having various fillers and stuff like that because they want to, for you, it was about showing a bit more, right?
Yeah.
You kind of thought, I don't show my teeth, so forget it.
It didn't look like I had fucking teeth, if I'm honest with you.
Exactly. So the goal for us, for you, was really to give you the lip support. So your lips have got something to sit on.
Yeah.
Now, as you're talking on the podcast that I've been watching since, you can see your teeth.
Yeah.
And that is more youthful. So the people saying that you look younger is a deliberate outcome that we're aiming for when we do this treatment.
Because I had a rather nasty underbite before. When I watched this back, and I don't normally watch this, but I was talking with you could only ever see my bottom teeth.
Yeah.
Very aggressive bottom lip.
And when you show more lower teeth, it makes you look older.
Is that a sign of aging? Is that what happens?
Because as we age, collagen gets less, holds your lip up less. Gravity takes effect. This goes down. So for me, for example, I'm going to look really old in 20 years because I already don't even show my upper teeth when I'm talking. But that's a way that we use the treatment to reverse time. So a lot of people come to me because of the fact that they want to find a way of looking maybe how they did. Not so much in your case because you're still young, but people who are, 50 plus possibly, they start to realize that they're losing their smile.
Do you get majority of people coming for cosmetic reasons or because of an actual health concern?
I think for us there's usually a functional issue with the bite. For example, for you, you were wearing your teeth down way too prematurely for your age,
but
right?
Why? Can I, just out of curiosity, because I've had more Botox shoved in that muscle than you could shake a stick at.
Yeah.
But why do I grind them so aggressively? Like, what is that? Is that just something that some people do?
Grinding is something to do with just the fact that maybe that's just how our muscles want you to kind of grind.
Tightly wound.
Yeah, it could be that it's actually to do with the way your teeth meet. It's not comfortable and your body's kind of like, it's not comfortable, let's get comfy and grind yourself away. Or it could be the positioning of your teeth. So the way your teeth were positioned, I saw you after you had, maybe like in the middle of Invisalign and at the end of Invisalign. And I think they had helped a little bit for us to actually get this treatment done because it allowed the bite to sit in a better position. So if your teeth are in a position where they're just knocking each other all the time, they're going to wear down. But now what we've created is actually we brought your upper jaw slightly forward using the feather veneers by adding to the surface, so barely even touching the tooth, because when we add a little bit, you don't need to reduce. And so now your jaw sits more like this, so you can chew without knocking your teeth. So overall, that's going to make not only you look a bit younger, not that was, the main thing for you, it was just to make you look like what age you are, and then actually at the same time protect your teeth.
Yeah, can we just put that out there? I'm 31, not 35. That's the Daily Mail.
Really?
They're fucking outrageous. They once wrote an article about me and a boyfriend. They said he was 28 and I was 35. I was like, are you joking? It's like, he's older than I am.
So now they'll guess your age and...
No, I'm much younger.
No, it's like 28. So yeah, in answer to your question, why do people come? It's always going to be some kind of I think my smile could look better. I think it looked good before and now I've lost my smile. Or I'm noticing my teeth going because of wearing down. Those are my main three kind of reasons people come in.
Do you get anyone who's ever... Can one be too far gone to have anything done?
No, never. I think it's just about being realistic about what the outcomes can be.
Yeah.
So do you remember when we first kind of went through it, I think when you came in, I drew out what I thought I could achieve.
Yeah.
At that point, if you've got a lot of compromises going on, we'll just design what the best possible design could be using your face. and then it's fine, right?
Yeah.
It's just if people have an unrealistic expectation that they want to look like, I don't know, Margot Robbie, and their face is not like Margot Robbie, then we can take inspiration from it, and we do that sort of stuff all the time.
Do you get a lot of people bringing in celebs' teeth specifically?
Yeah, but I think our process is so tailored for each person that by the time they come in, they know that we believe in facially driven dentistry. So I help them to understand why, for example, that smile looks really good. So Margot Robbie's smile looks really good because it fits her face really well.
Yeah.
And that's what we can do for each person. So that's what we did for you.
Yeah.
We tried to design something that looks like what your face wants it to look like. If that is done, you will get the Margot Robbie smile because you'll get whatever suits you.
Is that something that most dentists commonly think about, or they're just... Because I just, in the world that we live in now, a lot of stuff I try and work out, do people do or offer certain things because it makes money or because they think that person would actually look good with it? Does that make sense?
I think if you go into any kind of cosmetic thing as a professional and your goal is just to make the most amount of money, naturally your decisions will become compromised, right?
Yeah.
You'll do treatments that maybe you don't fully believe in, or you'll try and sell treatment that you don't think you can actually deliver the outcome. And the reality is you get caught out, you get found out.
Really?
You can't build a reputation like this, for example, doing it for so many years, if you don't actually deliver.
Have you seen it quite commonly with other dentists that you know?
The thing is, I pick up a lot of cases. So I'll pick up a lot of patients who've had, especially veneers, right? That's what I'm known for. Our feather veneers are the thing that I'm really known for. Minimally invasive and really natural. So if someone comes in to see a dentist and they think they want that, that's what they're looking for, but then they end up with something different to that, that's usually when there's a problem. Right. And so then that's when I'll see them. So I do see it quite a lot. It's not bad dentistry. It's just a bit on the generic side. And people's expectations are really high now. Generally, the people that I get in are the highest expectation. And so what they want is going to be at a level that not many dentists are able to provide.
Yeah.
And that comes down to the method that we've designed, like with the facially driving the treatment, designing it for the face. That's trial smile that you had, that temporary, that's all handmade, right? I made that fully from hand.
Anyone's contemplating getting your teeth done, this is unbelievable. You basically have teeth for 2 weeks that you just, if you don't like them, you can change them.
Yeah. So before anyone has the final veneers, I don't want to guess what it's going to look like or how your bite's going to work, because that's what usually gets guessed in this process. And so the lab who's designing the final teeth will decide all that for us. I can't say to you in my chair, this is what it's going to look like, Liv, and this is what it's going to function like, if I don't even know what it's going to be like. And for you, that's quite scary, right? Like, you're just sitting there and thinking you're doing something that's long term and you have no idea what it's going to be like.
Terrified I could get off there looking like all sorts.
You can trust me as much as you trust me, but ultimately it's still a bit of like blind faith.
Yeah.
And so we call it smile sculpting. I'll create each individual tooth using composite bonding, but I'll only use it as a temporary.
Yeah.
And that means I'm designing the whole thing for each person. It's totally bespoke. So it's like going in and having a bespoke dress made versus maybe having something off the shelf or having it kind of like taken in a bit here and there.
Yeah.
It's literally made for each person. So that way you get to experience it, you get to use it, I get to learn things about it. Like, does it look good? I can tweak it. If not, it's all handmade. Then we copy that into the feather veneer by hand.
It's such a good... Do many dentists do that? Because I'd never heard of that before.
We teach it at our academy because dentists want to learn it.
Yeah.
Because it's not how we're taught to do it. And generally, the only way to get the top level of outcome is to control it like that. So people come to learn it because patients are asking for something a little bit more tailored. Like, no one wants to come out generally looking like the same as everyone else.
Yeah.
So yeah, I think it's not something that's not available generally. It's our method. It's something we've created. It's something that we do at Bespoke Smile. But people are trying to learn because they want to achieve this sort of stuff, which is good for me. I mean, the more people that can deliver cosmetic dentistry at this level, then we're elevating it for everyone, right? So patients are going to benefit.
Can I, what is the most expensive treatment you do? Or what is the most expensive thing? A full set of feather veneers?
Yeah, I think it comes down to like numbers of teeth, right? So if you're doing full mouth, if you have to do upper and lower, now we don't have to do that. People often think if I just do my upper, then will it look really bad with my lower?
Yeah, well, I was wondering that because when I first came in to see you, I thought we were doing both sets, but oh no, just the top.
Yeah, and we can always add lower if we feel we want it at some point, right?
Because I don't see them, so there's so much
now,
Botox in that lip.
now we've switched it,
right?
So you're showing your upper teeth more. And also I advise you to have a little bit of work done on the lip and stuff to balance it out.
I think you were about to say now, and I was like, no, I've done all that.
So now your smile, if you look at, like, all of you should go and watch Liv's previous podcast stuff And now
you'll see
you'll
it. I look
notice
like I'm gurning.
you'll notice that we've flipped what's like the most obvious thing about your lower third of your face. It's now about your upper smile and lip, not about the lower. And that's from everything that we did. So yeah.
Pretty amazing. I suddenly just had a thought, and you wouldn't have watched this unless maybe your wife would have told you to watch it. There was a series recently, America's Next Top Model. Mm-hmm. Anyway, they made a thing recently and it was going up against like how bad it really was. One of the things they got one of the models to do was for a dentist to whack a gap in her teeth. What kind of danger is that?
Yeah.
Like, is that, if someone said to me, I'd tell them to go F themselves, to be honest with you. But like...
Yeah, I think if you don't have a gap and you have a gap put in, then to create a gap, you're just drilling it or filing it, right?
How bad is that for you?
I mean, if it's a small amount, then it's okay because it's not really going to damage anything. But to decide what's good and what's bad, a tooth is made up of two materials.
Yeah.
The bit on the outside is called enamel. That's strong. The bit on the inside is called dentine. That's weak. You don't want to do cosmetic dentistry or anything that goes into the dentine. If you go into that internal layer, then you lose strength, you lose durability, it's invasive, you lose longevity because stuff doesn't last as long. So, for example, with your teeth, I just had to stay within the enamel layer because I know that you want something that's going to last.
Yeah.
And I don't want to take risks. And that's one of the best things about like the feather veneer is that it's so thin that we can actually do it within the enamel layer. So if you're just getting a gap, for example, put in, which I don't think is usual, by the way. Like not many people ask.
No,
for
I think
that.
a lot of people get them filled in now.
Yeah. But if you are having a gap created, as long as it's within that enamel layer, I guess technically you're not actually causing damage. Probably better to leave it alone.
Yeah. What does cause serious damage? Because obviously the veneers. When people fully have like their teeth shaved down to the point they get teeth screwed into their jaw.
So, okay, so that's exactly why I created this, right? Because everything that comes with drilling your tooth to a little stump, and we've all seen like the Katie Price video and stuff like that happens in Turkey and other countries, and actually, unfortunately, in the UK as well. That's done because it's two things. It's easier to create a tooth to go onto that if you've got a lot of space to work with.
Yeah.
I'm working in 0.3 to 0.5 of a millimeter for the feather veneers. That's really technically difficult. So it's easier on that front. The second thing is techniques have evolved, or they should be evolving. Traditionally, materials are weaker. So if you were putting a veneer on a tooth, you'd have to drill the tooth to make space for it because the veneer had to be thicker. Now we don't have to worry about that. So the technique in the mouth should change.
Yeah.
So because it's thin, I don't need to make much room for it. So I barely have to touch the tooth or not touch the tooth at all. And that means that it lasts, it's stuck to the better part of the tooth, it looks better. But there's also a balance of not thinking that we can perform miracles every time without touching.
Yeah.
Sometimes we have to touch a tooth a little bit because it's worn down or there's a filling in it or the shape is a bit off. But any preparation that I do must stay within that layer of enamel and then it's going to be fine and safe.
And what people end up going to because it all comes down to money, doesn't it? But do people realise? I don't think people realise the risk of doing certain things. So, like, what is the actual risk? Obviously, I know it's cheaper, but going somewhere like Turkey, long term, firstly, do the teeth actually last? But also, what damage could that be potentially doing to you? Because how you hear these stories of people sort of, like, not with gold teeth, but how work you've had done can affect your overall health.
Yeah. I think it's true. Look, the thing is anything you have done should be done to a really high standard, should be safe. What creates something that's unsafe is if you're exposing parts of the tooth in dentistry, for example, that shouldn't be exposed. So that internal layer, because then bacteria can get into the nerve. You can have, if things are not stuck on properly. So if you're having something cheap, it's cheap for a reason, right?
Yeah.
People are quite happy to ask why am I more expensive? But they're not even asking the cheap guys why they're so cheap.
It's so true, actually.
So maybe that's a better question.
Yeah.
Because there's always going to be a reason. Like it'd be quite easy for us to demonstrate why the fee isn't $3,000 for 24 teeth. Like, it's pretty easy for me to explain that. But let them explain how they're able to get it that cheap. Like, what is it they're cutting out of the process? I mean, my materials cost me more than what they're even selling it at. So something's got to give, right? So the thing is long term with Turkey and all these drilling stuff that goes on, it basically means your tooth is just irreversibly damaged and you can never grow that tooth back. So everything you have stuck onto it doesn't last as long. Things fall off more because there's not as much to stick to. You have no options or limited options left afterwards. You're not going to get the longest time out of it. Yeah. And then when you have to change it, what are you going to do?
End up with dentures.
Or like crowns, or they already put crowns, they call them veneers, they put crowns, and then eventually maybe you have the tooth out, and we need to build in longevity.
But do you think I think this is the problem though, because with social media everything's a quick fix, isn't it?
And also if you get the treatment planning people with like an email, like you could send a picture, and then they just give you packages. It's like, you can't buy teeth on a package. Like, sometimes people message us and like, what packages do you have? I'm like, what are you talking about? Like,
what do you mean?
You like, you can have 8 teeth for this, or 10 teeth for this, or 20, it's like a package deal. Like, and then it's at 24 teeth in the really strong material for 3-4 grand. Oh, that seems like great value, but hold on, what do you even need? Well, you don't even need 24 teeth, so just leave it.
Just in your time of doing dentistry, have you noticed a massive difference? Firstly, in what people are after, but also just the way it all works. Like, do you think because of social media, things have gone slightly out of control? Like, people think they need certain things when actually they don't.
No, I think so. For me, social media has been really positive because it's allowed us to show the dangers of stuff that we don't want people to have. So invasive stuff that doesn't look right and doesn't last and isn't made for your face. Like, that's what we exist to put out there. And we were talking about like social media and like all that stuff earlier. For me, that's all my messages. It's like, if you're going to do it, firstly, appreciate that actually it can change your life.
Yeah.
It can be amazing, but do the research and go and see someone who cares about those things if you care about them too. Don't just assume that everybody gets it and every dentist is the same, because they've got to understand those things. What I have seen change, it could be because my reputation has grown and people have seen what I've done. It could be that, and so the people that I attract now, or it could be that this has changed everywhere, and I think it's probably a bit of both. But every patient now's expectations are just sky high.
Well, yeah.
Rather than maybe 20 years ago, everything was a bit better. So, that's better, happy with it. But now, people, that's our bag. It's what we deal with, right? We don't really deal with people who have low expectations. They don't even need to see me, frankly.
Yeah.
But what I'm seeing is that everybody holds a mirror, like right here. Everyone's on the phone to like their sister in the car after the appointment.
I'll be honest, I didn't even know what I wanted. You actually told me, because I was like, I didn't think about it.
All of our patients are reasonable and they understand that. But what is happening in the industry as a whole is that expectations from a patient perspective are getting really, really high because they're seeing a lot on social media. Yeah. And it does create this sort of like underlying dysmorphic kind of tendencies.
I think people's idea of beauty is completely, I don't know, does anyone really know what the idea of beauty is anymore? Like, who would you, when people come in with a celeb photo, do you think Margot Robbie's the top celeb that people say?
For me, I put out stuff of what I like, right? So it's like facial harmony, it's natural beauty, it's all that stuff. You can still have white, nice teeth, but it can look amazing for you. So the smiles that I get shown generally are smiles that look like that.
I would like someone to bring in my smile and say they'd like it.
Well, I showed someone your smile the other day. I didn't tell them it was you, but I showed them that and they were like, that one's really, really good.
They also didn't see my bottom row. Oh, that's good.
So yeah, and I think you said something interesting there. It's like, what's changed? I remember maybe 10 years ago, so I've been doing this nearly 15 years now. So I've seen kind of things, trends and stuff. So one thing I always say is I never follow trends.
Yeah.
Elegance and looking harmonious is going to be always on trend. I'm not going to do something in dentistry that's like hot now and cold like in a year.
What is a trend with dentistry, just out of curiosity?
Big, white, straight, all that sort of stuff.
That was a look at one.
It was all of it, right? And that kind of trend is going, I think.
Yeah.
And so people are dissolving stuff they're having in their face, or they're trying to make the face look less done.
Yeah. Which I'm really relieved about. Can I also just say something quickly though? I don't think people think about their teeth when they do think about their faces. Like, I look at a lot of people getting all this work done, and actually, look, I'll be totally honest, my top lip was on sabbatical. Someone said it on the Daily Mail, and they were right, okay? And I completely appreciate that now. I did have a tiny bit of lip filler, but my mouth, sorry, I completely interrupted. My mouth was something that always bothered me. Anyway, second I've got my teeth done, now it's perfect.
So this is really important. If anyone's watching this and thinking that they have lack of visibility in their smile, a lot of that is down to their teeth. There will be some that are creating a lack of visibility by having too much filler in the lip, and they're thinking that they need to see more teeth and stuff and having filler in.
Yeah.
But actually, it's usually a combination of a bit of both, or no filler at all and having your teeth actually improved.
Yeah.
And I think it's just people see the two things differently. I wouldn't expect people to know that actually how much we can improve the face by doing the teeth.
I didn't even think about it. And then when you said about doing like the Botox and said, no, it's to, listen, let's get this straight. The ciggy fell out of my mouth. I dribbled. It was awful, actually. Did I tell you this?
No.
I went out for dinner. This is recently. Anyway, I had a bit of Botox on one side, a lip flip. Anyway, you see these nightmares on Instagram of people like this. Anyway, I went to like gargle and went, flew down my face. I was like, this is mortifying. Anyway, it's now settled down. But it was amazing because now that also does help with the teeth.
Yeah, and see now when you're smiling, it basically just fits the face perfectly. You've got balance both sides. You haven't got symmetry, but that's not what it's about. It's about harmony. So people looking at you will see, oh, everything looks really symmetrical. But it's deliberately asymmetrical to work with the face.
Do you get people coming in asking for odd things like fangs?
Yeah, we get some requests like that. And the thing is you see, for me, that's a trendy thing, right? They might want it now and then they kind of don't want it later. So just we generally will, those sort of things, will use materials and stuff that are kind of semi-permanent and composites and stuff like that you can just kind of like touch it up and then you're probably going to change your mind.
On getting some fangs?
It's like a tattoo. I see these things as like a tattoo.
Yeah.
Right, it's a big deal to get a tattoo removed. So think about it a lot.
No.
Whereas things like that, you probably will change your mind. So also function, you can't just do whatever you want. Like, you got to see if it works.
But we don't get menacing.
We don't get weird requests generally. Most people want what we like to do, which is like an amazing facially harmonious smile.
Yeah.
And the best veneers. But sometimes it will be fun because I'll get pictures of someone 20 years ago and they'll say, could you make me look a bit like that? And I'm like, well, yes and no. Yes and no. Let's see what it is about your smile that you feel is missing now.
Yeah.
And so sometimes I'll do like a little bit of a crooked one or one that's a little bit rounder compared to one that's square next to it. Just try to find their character in the smile. When I'm creating it by hand using the smile sculpting and copying it, then I'm able to do that. To inject like a little bit of something. And that keeps your magic, right? Yeah. Otherwise, it's just
such an art, isn't it?
Cookie cutter.
I never really thought about it.
Do you remember when I did your trial smile? It was like we were sitting there for I think you were there for about 2.5 hours, 3 hours, and
I was numb. Let me tell you.
And I was just painting each individual one. And if I wanted to create something that was a little bit different, I could do it then.
No, that was great. I mean, my face could speak afterwards. Didn't mind it. Have you ever had an incident where someone has tried to link anything back to dentist work that actually was nothing to do with you?
We were talking earlier about like sensitivity in teeth and stuff like that. After this kind of treatment, it can be a bit sensitive and it can take time to settle, right? Because the body heals and all that sort of stuff. But I think there is definitely a link between certain hormonal changes and things like gum inflammation, sensitivity. This is not from a scientific perspective, but from my experience in the kind of demographic of people that I see, it's definitely people who might be going through hormonal changes, like middle-aged women, etc., who do suffer more from the gum inflammation and stuff like that, the sensitivities. And, it could be before or after treatment, like whenever it goes. I mean, it's nothing permanent, but I do think that does play a part, and I think it's to do with inflammation in the body.
Really? More so, do you notice anything similar with men at the same age?
Not as much.
It's always the way, isn't it? Like women do just have it slightly harder, but I wonder, that is interesting.
I think it's inflammatory stuff, definitely. And I see it. We see it. I've been asked to comment on quite a lot of menopause stuff, and I always say, look, I'm not an expert, but what I have noticed is definitely certain group of the population, like middle-aged women who might be going through that, definitely experience things that are unexpected. Like you wouldn't expect to have gum inflammation. You wouldn't expect to have sensitivity, and it can just take a little bit longer to heal up.
It's interesting,
yeah,
isn't it? It's all linked. I get sucked in sometimes to watching reels, doom scrolling, and I've come across a few different things where people have had some sort of ache or pain in a body part, and they've said, and it says, go to the dentist and get this tooth removed. Is that Nat's looking? Have you never heard this? I'm pretty sure I had an aunt, I don't know if this is true or not, who had really bad arthritis or something happened, and they said, get rid of that tooth, or there's something wrong with that tooth, and then the pain went. Probably wasn't an aunt, it was probably a family friend who was probably pissed. But is that actually a legit thing? Like, how much connection is there from your teeth to the rest of your body?
I mean, there's a lot of stuff that is not, like, there's no studies on it and stuff, right? So alternative, maybe, theories. If it works, then that's good.
Niche.
Does it work? Is it some kind of a placebo? Who knows? I'd probably say don't go and get your teeth pulled if there's nothing wrong with the tooth.
No.
Because someone says it, like you got a pain in your ankle.
Take that tooth out.
But if there's something wrong with the tooth, then treat it as dentistry. I would never say to a patient, oh yeah, let's do something like that, because it might help you, like, your hip
Lose a
pain.
bit of weight.
Like,
I
don't know. I don't know enough about it to commit to permanent change like that. But there's a lot of stuff out there about root canals causing cancers and all sorts of things. You don't know whether it's just because of the fact that there's so many causes for things like cancer, or so many links, and also a lot of people of that generation have already had root canal treatment. So is it just that the samples are always going to have people with that treatment, and it's just more people will have a root canal treatment, and then we'll have like a stomach surgery. So like you're going to have more in the sample that have that. So who knows?
Is there any not guaranteed, but legit health things that go on that are very much linked to teeth?
There are links between heart disease and gum disease.
Yeah.
The bacterias are similar and the same. So it's always worth having healthy gums, right?
Yeah.
So that's one thing. The other thing that's really common and well known is diabetes. Diabetes affects healing in the body in general.
Okay.
So it will affect the healing of gums. So people who have uncontrolled diabetes will have more gum disease, generally.
Interesting.
Because the body is trying to heal. The gums are trying to heal. So they get inflamed because it's sending blood supply to the gums to be like, we need to fight something. But it's delayed healing. So they don't ever kind of come out of that until they control the diabetes. So, and then the other thing is medication. Blood pressure medications, other medications, taking lots of medication. All these things generally come out on the gums because the teeth are developed. Once the teeth are developed, you can't have calcium being sucked out of the teeth and things like that after it's been done, after they're there. But then it's things like acid. So I think we discussed that, right? I think I
like
asked
electrolytes or apple cider vinegar, all these. Because that's what I was going to ask. You finished, sorry.
That causes wear of the teeth, acid.
Well, this is the thing. All this like health, have you noticed because of the sort of health trends that go around now, that the damage to people's teeth is incredibly different to what it used to be? Because you look at this stuff that people are taking and I'm just like, I mean, listen, something terrible happened to me. I'd had a turmeric shot. I was borderline glowing. did it with my retainer in like a moron. And they were fluorescent. Olive oil and this lemon juice shot that I'm seeing everyone doing who seem to look 10 years younger. Is that bollocks?
I don't know if it's going to help anything, but with your teeth, it's acidic, right?
Yeah.
So the thing is now things have changed. So people my patients don't tend to have a lot of tooth decay. They keep their teeth longer. They don't have decay. I'm not doing loads of fillings and stuff like that. Although we offer everything at Bespoke Smile, so if someone needs it, we can do it.
Yeah.
But it's not like something that we're doing kind of routinely because there's a lot of decay. So people's teeth are maybe getting better on that front. But what's happening is because they're keeping their teeth are wearing down more. So the problem now for dentists to learn how to solve for patients is going to be tooth wear. How are these people's teeth wearing down? How are you going to fix that?
Yeah.
Not so much how you're going to drill and fill a hole. And then the things that cause tooth wear, like healthy patients who I know like have PTs and like do healthy stuff, I'll often see if they've been using apple cider vinegar or like lemon shots and like all that stuff, I'll see that on their teeth.
Really?
Especially if it's been happening for a while, because they're basically just washing your teeth in acid. The other thing that we'll see is after things like Invisalign, like what you had, sometimes that treatment's done in a way that leaves people's teeth like grinding against each other and they kind of like get more tooth wear prematurely. So these are the problems now. Not so much drill and fill.
Yeah.
It's more the teeth are there, but they're wearing away from acids or anything else. Also things like health related, like gastric reflux. So people who've got like acid reflux that comes up, that causes tooth wear. So yeah, that's the latest, I think, problem, and it's going to be a problem going forward. If you want to limit teeth wearing down, firstly, go to a dentist that understands your bite and make sure that your teeth are not wearing themselves down, right? Upper and lower are not kind of grinding themselves down. That's the first thing. The second thing is if you're doing treatment, choose a treatment that's actually going to improve your bite and protect your teeth. So things like the feather veneers will allow me, like in your case, allowed me to move your bite around a little bit and allows us to protect the areas of your tooth that were worn down. So now that's covered. That's not going to wear because it's covered. So it's protected. So there's certain treatments that are out there, but they just have to be done with that in mind.
sorry, I completely forgot to ask before on this. Biggest thing to, and let's not say cigarettes, worst thing for gum disease? Cigarettes. It is, isn't it?
Yeah, so like gum disease is what creates looseness in the teeth and people's teeth fall out. Not to be so we get a lot of people asking for solutions to gum recession, by the way. Gum recession is a massive thing. We get daily people
What
asking.
is that when the gum's just going up?
They're just yeah, so like long in the tooth.
Yeah.
So that people think is gum disease, but often it's not. Often it's actually because your gum's wearing away for some reason. The bite's heavy on it, your gums are thin, you're brushing a bit heavier, or most of the time it's bite is heavy on that tooth, or the shape of the tooth is kind of like a bit bulky and it makes the gum go. And then there's gum disease, which actually means you're going to lose your teeth eventually, because the recession of the gum doesn't mean you're losing the bone that's holding the tooth underneath. If you lose the bone through uncontrolled diabetes, not having a hygienist appointment, not brushing effectively, or you're susceptible just genetically, that needs to be controlled. Otherwise, you'll eventually lose teeth.
Made my teeth feel funny just thinking about it. And what's the what other health things that one can do to try and maintain other than the obvious brushing your teeth? Flossing, mouthwash.
Mouthwash is there to make you feel good.
So there's no actual health benefit to mouthwash.
Imagine a boat sitting in a marina with like algae all over it.
Yeah.
Just like chucking a bit of water from a bucket over it.
That's what it's doing.
That's what mouthwash is. But if you actually get like a brush and you scrub it off, that's what your toothbrush does.
Okay, and now let's talk. I want to talk about any trends in terms of teeth things that actually are not legit. Oh, a tongue scraper.
Tongue scraper's good.
A tongue scraper. Okay.
Tongue scrapers have been around since like hundreds and hundreds of years in Asia.
Yeah.
There's like a very popular Indian technique is to use a tongue scraper.
And
I remember my parents and my grandparents had them.
Really?
Now it's becoming really popular. And yeah, you just take away any bacteria on your tongue.
Okay, and what's another thing? Because I saw one about gargling coconut oil or something. Oil generally in your mouth.
Like
is
oil pulling?
Yeah, wait, why is it called oil pulling though?
Because it pulls out toxins and stuff from the inside,
And so
supposedly.
you just swish it around your mouth for an hour in the morning?
Yeah, for quite a while.
Really?
It's quite a long time to keep something in your mouth.
It's very long time with my dribbly lips, honestly. And what, it actually is beneficial?
There's evidence that is around now to suggest it's beneficial. There's also evidence to suggest it does nothing. It's just one of those things again.
Yeah.
My thing is, look, as long as you're not using stuff that's acidic, then you're okay. Like acidic stuff will cause damage to your teeth. So anything that's low pH, like lemons and all these sorts of things. And there's also certain toothpaste are like a little bit abrasive.
Yeah.
So just choose stuff that is safe and not acidic, and you'll be fine.
Okay. And what about colourful stuff in terms of staining?
Well, your uppers are not going to stain ever.
Well, yeah, I was going to ask you, they're never going to change colour? Really? Even if I have a couple of packets of...
Yeah.
Does it make difference drinking things with a straw?
Yes.
Oh, fine.
If you want to stop your teeth staining, firstly, if you have like a porcelain veneer, like what you have on your top teeth, that's not going to stain. So that's great. Drink as much coffee, red wine, tea, whatever you want.
Yeah.
It's not going to stain. If you have natural teeth, they will be more porous to stain. So if you use a straw, that's good.
Yeah.
You can do whitening with whitening gels and trays. By the way, you know the light that people sit in like Westfield, and they have like blue light on their teeth to whiten them, and then they go off for like an hour. That's just a
Another
scam.
craze. A phase or a craze thing, really?
It dries your teeth. So if you imagine, the example I give is like you've got a river, you've got rocks at the side of the river. Let's say you take one of the rocks out of the river, leave it out there for a day, it's going to look chalkier, right?
Yeah.
Put it in the river, it looks darker. That's what your teeth do. So your teeth in your mouth are hydrated because there's saliva around them.
Yeah.
If I just lifted my teeth like this for a while, they'd get dry, they'd look whiter. That's what that does. It dries your teeth. It doesn't do anything.
People, these con artists actually making money. But do people believe
Well,
it?
I think initially, even dentists didn't know that. So we used to have, like when I started the practices, I had these lights that I inherited from the previous guys. And we were like, oh yeah, these are great. And then we realized, we actually did a test. We had one person in one room, one of the team members. We did two people with the same color teeth to start with the light on. One person literally wearing, that ring thing that I put on your teeth.
Ring. And honestly, I thought it was going to burst on my filler.
Yeah. So that like speak out game, like people have that ring, put them both in, same amount of time, came out, same color.
Really?
Yes, it just doesn't work.
So interesting.
So what does work for whitening is trays that you get made from your dentist and the gels that you put inside. That will work.
Okay, and what about teeth whitening strips? Do they really, ones you buy sort of whatever over the counter, do they actually work? Or
Depends on the level of hydrogen peroxide in them. So in the US, they're able to sell higher percentage, so they can be used and they are actually effective. The problem is they don't fit that well onto the teeth, so you might not get an even color. You also, I don't think you can get strips that go right the way to the back. They only cover the front
bits,
6.
yeah.
So that's another thing. Also, I think with whitening,
Yeah, can you say that fact again about the whites of your eyes? Because that was
Oh, yeah.
fascinating.
with whitening, people generally think that whitening might be something not to do for 2 reasons. That it kind of damages their teeth. It doesn't. It pulls the stain out from the tooth. That's why it might feel sensitive during the process. It doesn't take a layer off like
Yeah.
polishing a car. So it's totally safe. The other thing is people think that they'll whiten their teeth, it will get excessively white. It won't. It will just go to your natural colour. So be realistic.
I did slightly have that concern. I thought, because I didn't know what I thought was going to happen.
If the teeth are worn down at all, let's say they've had a bit of heavy force, let's say your enamel's thinner or the development of the enamel is a certain way, you're not going to get as much of a result from whitening. And that's often the reason why people come to me for the feather veneers, because I can create a colour then. And the colour I'll always choose is, and I think I've said to you before, is I'll try and match the white of the eye.
But what happens though when my eyes no longer look this white? Red.
We're not trying to colour match.
Yeah.
We're trying to tone match. And there's a difference. So the way I see it when I'm choosing colours for people is it's got to look like when you walk into a room, you've got to look vibrant. You've not got to have your teeth walking into the room before you do.
Yeah.
If your eyes and your teeth are competing with each other, then and your teeth win, then it's just going to look like, like a joke.
Big tooth girl, yeah.
And some people want that. That's not what my patients want anyway. It's not what we do. And so if I want someone to look really elegant, really high end, like it works for their whole face, the tone of the eyes is important. Generally, if you break it down into simple terms, it's cold white or warm white, or something in between.
Yeah.
And so because we've got our own laboratory where your teeth are made, it was made by my ceramist I've worked with for 10 years, she will hand layer each individual patient's tooth. Each veneer takes 10 hours to make. The layering of each...
It's 10 hours to make each one of these.
So each one will be layered with a specific tone in mind. So I can create, this is one of the things I love the most now, like what my setup is that I can create a tone that matches someone's.
Yeah.
That is not like an off the shelf. So when I'm choosing colours, I'm choosing custom colours for each patient generally, not just one colour.
It's
and
amazing,
the
isn't
eyes, the eyes, the inspiration always.
I can't believe it takes 10 hours to make one tooth.
know,
That
yeah.
is crazy.
You could do it super easily.
So wait, hang on.
but
If one
we
of
take that
these
long.
comes off, which it never will it? I've got to find it and hold on to it.
Yeah, so firstly,
Yeah.
that's a really good question.
Found it.
Yeah. That's a good question because people worry about that. And I think if your treatment's done to a high standard, stuff's not going to fall off.
Yeah.
If your treatment's minimal and stuck to the enamel, that bond's really strong. It's not going to fall off. So if you test it with the trial smile, you already know what's vulnerable, what's not. And, we need to know that stuff. And then maintaining it, you're going to wear, I gave you your retainers this morning, you're going to wear retainers every night because you had Invisalign before anyway, that's going to protect it. So all that stuff's avoiding it.
Yeah.
If something came off, because let's say freak accident, you bit into something and it were, opening a packet, or I saw one of my patients, I did her teeth like 7-8 years ago. And I saw her recently where one of her veneers had come off. I was like, how did that come off? And she goes, oh, I was opening a packet of the noodles or whatever. He goes, I've been doing that ever since you did these.
No,
For like 8 years.
I haven't actually dreamed of doing that. Although before I had my teeth done, I would open beer bottles with my teeth.
Yeah.
And now the thought of doing that makes thousands of pounds in my mouth.
I was like, what are you doing? She's like, I know. I just forgot because they're just my teeth now. And I know I shouldn't have been doing that, but you just do things with your teeth that your normal teeth are not designed to do. So a natural teeth's going to chip, or anything you have on that teeth's going to chip or break. It didn't break or anything. It just stuck it straight back on, and she's never going to do that again. So it's not going to happen again. But yeah, I always say treat your teeth like they're teeth, not like tools.
Yeah.
And you'll be fine.
Do you not often, but do people ever come in and request certain things that you're like, normally it's not something you would ever have suggested they do, but because they're desperate to have it, whether it's like teeth that are slightly too big for their mouth or like something specific that they really want, but you're like, where does your sort of, I don't know.
I have had that. And I think the thing is, and you'll know, our process is really collaborative. So I'm always trying to understand what someone's goal is, but then I'm also trying to guide them to make the best decision for themselves.
Yeah.
Because often the patient won't know what they don't know. And if I can show them and educate them as to this could be the perfect shape for you, there is always room for them to have a personal input in that. So if they want to have something a little bit off what I'm saying, that's cool. But I think I'll just educate them through that trial smile process of we could do that, just show you.
Yeah.
And then they actually sometimes change their mind once they've seen that. They're like, I see why that doesn't work for me now. Or they like it and they accept that it doesn't quite fit, but that's what they're really looking for. And that's the thing. It is really creative.
Yeah.
It's got to be.
Yeah. Is anyone like too far down the rabbit? Well, yeah, we just sort of too far
Yeah.
down the rabbit hole that you can't come back from.
Do you know, the thing is choose the right person to begin with, and you'll have something that lasts a really long time. And if you have invasive treatment done, you're going to have it changed sooner. When you have that changed, then you're losing options. And so someone like Katie Price, for example, who's had dentistry God knows how many times, I'm not going to guess a number,
Yeah.
but it's a lot. Then your teeth are every single time, because they're already damaged,
Yeah.
because it's invasive, then they just keep getting more, because she goes places where they don't care about that. So they just keep drilling. She's left. I don't know what she's even got left now.
If she came to you, would you treat her?
I think, well, I don't treat people if I feel that there is maybe a psychological or emotional reason where it's not the dentistry that is the answer.
Yeah.
And so that's something we do in terms of our screening process. But in terms of her teeth, it's just them accepting that these options are limited now. And the design that we can create might be a little bit limited. We'll always do our very best to create the best thing.
Yeah.
But they just have to be a bit more realistic, I think.
Do you find a lot of people have come to you and actually the issue's not really their teeth, it's actually more of a psychological thing?
Yeah.
What sort of things?
I think grief is a big thing.
What do you...
So if I've had things where people have gone through a loss.
Yeah.
And it's always there's something about their teeth anyway. It's not like they suddenly have great teeth and they suddenly hate them. But it's trying to solve, and it's like everything, right? It's like what therapists would always say. You're trying to compensate for something that is not there for you. So if it's you're going through a loss of something, or if it's you have a self-esteem thing or something like that, and you think that, oh, I'll do this and then I'll be happy.
Yeah.
Or I'll do this and I'll be happy. All these negative emotions will go away when I do this. I definitely believe that having a smile makeover that is really crafted for you in the safest, most beautiful way can change people's lives. Absolutely, it does, and I see it every day.
Yeah.
But what it can't change is how you internally feel about yourself. And so if there are things related to that, and you think that this is the answer, it might give you that temporary elation, but then actually those are deeper rooted. It's not my job, right? I'm not a psychologist or a therapist, but I can definitely highlight when someone comes in for a consultation where they're at, but that's over a long time.
And
I've got it wrong
in those
before.
situations, what do you sort of do / suggest to them?
I think if I can see an obvious benefit to doing the dentistry,
Yeah.
because I'm doing it safely, I'm not worried about that kind of thing. But what I will always try to do is, if there's answers to the dentistry that I can create something really nice and it solves real problems, then that's fine. But if we're solving problems that kind of don't exist in the smile, then that's when you start questioning as a professional. And this is what I mean about people will get caught out if they're going to just start selling treatments to people that
Well, no, because this is what I was going to say. I think it's
then
very
I'll guide them and say, do you really think it's your teeth?
You do it that way though, because I think, and you see a lot of sort of celebs come forward now saying, oh, they were really unhappy, so they had all this work done. This is probably more on a cosmetic surgery front.
Yeah.
Had all this work done because they thought it'd make me feel them better. When actually now they look and they regret every single one of it. It didn't make them feel happy. It actually made them more self-conscious. And it's just sort of like, I find mental how there are some doctors who are encouraging of this stuff because of the financial benefit. They don't sit there and go, actually, you know what, you really don't need this, and I don't think you should actually have it.
You see, I just think that every doctor, dentist needs to care more about one thing, and that's their reputation more than anything else.
But I feel like it's slightly odd that that's not a priority in terms of what some people care about. They just want the money overrides all of that.
But I think some patients can be very persistent as well.
Yeah.
So, because maybe they've had a few no's, they're looking for the person to say yes. And so, ultimately, clinicians are generally ethical people, right? And so, and also kind, and it's kind of like, oh, actually, I want to help them.
Yeah.
And you might actually think that will help. And thing with facelifts and surgery and stuff like that is, I think what people forget, and I know plastic surgeons will always tell patients, is that your aging process doesn't just stop after you have a facelift.
Well, no,
you're
'cause the
still
rest of
going
your
to
body's
age
dropping.
10 years later.
Yeah.
Your face is still going to look different 10 years later. So that I think people do forget.
Yeah.
With that also, there isn't really a way to preview. You kind of have to just trust.
Well, hang on.
We have a preview option.
With the teeth. I was just going to ask you really quickly. Did you see the stuff about Kris Jenner's supposed facelift now not working? It was melted.
Oh yeah, but that's nonsense.
Well,
She
she
actually
is sort of-
released a video out to say that people are saying I'm annoyed at my surgeon and stuff like that. It's
Oh,
all
fine,
nonsense. It actually is great.
The press is just relentless, isn't it?
But I have had patients who've had facelifts and stuff, and then over time things have changed. And so I'm because I work with patients who've had that sort of stuff. I'm very used to knowing when to time the treatment for us, how to get the best outcome in terms of like working with the result of the facelift, not treating too early because healing can take up to a year after a facelift.
Yeah.
So, with me, it's kind of a case of our reputation matters more than anything. And if I start like doing things when they shouldn't be, it's not really going to help. You're my advert walking around with my teeth. And if people say, if people are walking around with stuff that doesn't represent my values, then that's not going to do me any favors, right?
No, it's so true. So true. I know, just in case anyone has been asking Dr. Sam to do my glorious teeth. Weird, maybe not myths. What is veneer breath? The word breath is disgusting. I'm really sorry. I had someone the other day, talking about a mouth breather. Why would you, that expression as a whole is revolting. Breath. What is a veneer breath?
Okay. If you have, whether it's veneers or anything else, that doesn't fit properly, right? You've got a tooth, you're sticking something to it. It's got to fit properly.
Yeah.
If it doesn't fit properly, you might have gaps around it. That traps bacteria.
Oh, it makes me feel unwell. I'm sorry. And
basically, that's it.
Can
and
I
it might
ask
give
you-
you bad breath. That isn't a thing. You don't have that.
Oh,
because your
thank you.
teeth fit properly.
Yeah.
So that's basically it. It's not something you get with veneers. It's only if you have bad treatment.
With people with bad breath, do they not know they've got bad breath? Because I've witnessed people with bad breath and I offer them a mint, but then, do you know what I mean? Like,
But is it the same as like BO? People don't know.
But did you not know? Surely during COVID, when people were wearing those masks, they would have smelt their own breath and been like, that's disgusting.
Maybe. Sometimes with the breath thing, it's not the mouth.
It's
as
your
well.
gut.
It's your gut, yeah.
What is it with your... Also, that's another expression, leaky gut or people's gut health. Like, it's horrific, isn't it? I don't want to talk about someone's gut health.
Yeah, I think it's like, again, acids. It can be bacteria in the stomach, all that stuff.
Okay.
Gum disease also causes bad breath. So we have a thing in dentistry where you can smell gum disease.
What does that mean? What does it smell like?
You can't really describe
I
it.
get really funny and put off by funny smells. I don't know what it is, makes me feel weird. Veneers come in one size.
Oh. Yeah, well, I mean, look, I guess you can make them all one size if you want.
You look ridiculous.
The three biggest fears that my patients generally have. What am I going to look like? Am I going to look like all my teeth are just one block line? What are you going to do to my teeth? And how long is this thing going to last? Those are the three top things. And that is what they're afraid of, is going somewhere and they end up with like, the same teeth that everyone else has. The answer to that is go and have it handmade.
Yeah.
Don't. Before you go somewhere, just check that they're hand making it to suit your face and then copying that design. So that's the key bit. If you end up with just a generic design, it's going to look from a lab, like digital.
Yeah.
AI and dentistry, the number of people that are asking me, can you show me using AI? I'm like, yeah, but it will look terrible and it will not look like anything that's, going to be realistic.
How do people not understand that AI is not legit? Like how... Because I had Dr. Motox in it and he was saying what's happening at the moment is their patients are putting their photos into ChatGPT and asking what they should get done.
Yeah, I've had that.
Do you say, well, you're completely fucking mental?
I shut it down straight away
okay.
because I basically, what that stuff does is it can create problems for the patient, and they start to think that this is, the reason why we have our process is that we're going to create it for you. Whatever it is going to be the best that you can have. If a computer does it, it's going to be whatever the computer thinks.
So
and
you're
that isn't
never going to be
good.
replaced by AI? It's pretty amazing. I could be, though, to be honest. People might prefer it.
Yeah, just clone you.
I think we'd have me in Spanish.
Maybe there'll be dental robots. Maybe that's something I'll work on.
It's interesting though, isn't it? Does it, just out of curiosity, does it worry you for the future? Just in terms of the way life is generally, in terms of like, it does.
Oh, for dentistry?
Dentistry, just everything. Like the way we all look. No, but because it's interesting, isn't it? Like
what concerns me about all this is, well, firstly, I already have an issue with like marketing within like cosmetic dentistry, is that you really need to have the cases to back up what you're saying.
Yeah.
And if you use AI as a marketing tool, quite simply, someone could invent a load of before and afters, right?
Yeah.
How do you as a patient know? Then you go and you don't get that. And then
I get sucked into it and I believe it. I also believe that the reviews under everyone's things are legit.
Yeah.
Having faked some of my own reviews for my website, I can tell you right now, we can't have that in there. Mine are genuine reviews. But no, but I actually, I'm a bit thick, obviously, but I forget, I believe all that stuff before and afters, because I notice it a lot with hair care, and because I talk a lot about with hair growth, I've looked at a lot of things of people showing before and afters, and it's complete bollocks.
I think you have to do the research of like, does the credentials and the
Match up.
reputation, everything match up with it? Like, you're not going to have someone producing incredible work if they don't have some like reputation behind them.
Yeah.
So don't just look at the before and afters. Look at that, but then look at everything else.
Yeah.
Yeah.
Okay, one more myth. Do veneers rot your natural teeth?
So, you know, I said earlier about keeping the veneer thin and in the enamel layer. If it's stuck on really, 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 really well, then it's like impenetrable. That's it. It's done. But if you have something that's not fitting well, or it's drilled too much and it doesn't really fit well, you get leakage and bacteria can get underneath it. So it's the same thing as veneer breath. If it's done well,
We can't ever say
absolutely
veneer
fine.
breath. It's really upset me. I'm going to have to start. I might tell people to wear masks.
You just, you don't need to brush your teeth under the veneer. It's sealed.
Yeah.
So you brush the teeth like normal. And that's it.
And any maintenance veneers, is it any different just to normal teeth, or is it exactly the same as normal
Exactly the
teeth?
same as normal teeth. See a hygienist, brush your teeth. I like people to wear retainers, not because they've had veneers, but because we know as time goes on, teeth move. So even if you do nothing with your teeth, 10 years later, 5 years later, they'll shift and move. And so if you keep them in the same place, retainers are the best thing ever.
Okay.
That's it.
Interesting. We've got some listener questions. Number one, can I get veneers fitted cheaply? Of course you can, but don't.
I have a concept of like cheap, fast, good. Decide which one of those
When
things
we say
matter.
cheap though, like let's a figure here. Well, how much are we talking? Say I had what you did for me, which I know they obviously won't do in Turkey, but say someone wanted this look but went to Turkey, how much would they be paying for that?
Well, I've heard of people going to Turkey and having 24 crowns on their teeth for like £4,000.
Do they come out without a kidney or something?
Well, have you heard that one too, right?
Oh, with the boob job?
Yeah.
Yeah, is that legit or is that not? Someone said this, told me this. A girl had gone to Turkey to have a boob job. Anyway, came out, she loved them, they were phenomenal. Anyway, a couple of weeks later, didn't feel too well. They'd harvested one of her bloody kidneys. Weird that you wouldn't notice one of your kidneys gone at first. Anyway, then went back to find the clinic, it was non-existent.
Yeah.
I don't know what the risk is. Surely you just wouldn't even bother. Well, I don't know. Does Invisalign work?
So we do a lot of Invisalign, right? We're not an Invisalign, like that's not the
Yeah.
only thing we do, but we generally use it for people whose teeth have moved again after braces previously. It's tiny movement, they're kind of happy with everything else. So my dentist, because we've got a big team, they're doing a lot of Invisalign. It does work in the hands of the right clinician. So Invisalign's super clever. You scan the teeth, you send it off to Invisalign, they will plan it using AI, and they'll make your aligners and your teeth will move. The thing is if you just leave the computer to do the plan, it will not work properly.
Right.
And that's why you hear about people being, I'm in Invisalign for 2 years, it hasn't moved, or this or that, and all that sort of hassle. If you use it effectively, you know how to play with that computer so you can put in the right information, which is really the dentist has to learn that.
Yeah.
Then you'll get your treatment times down. So we don't generally see anything that takes above 6 to 9 months,
Okay.
no matter how complicated it is. Very, very rare because we know how to play with that system. So it's a product, but just find someone who's really, really good at using that product.
Yeah.
Don't just assume that Invisalign's the same everywhere. I'll just go to the person that's the cheapest.
Well, this is what I was going to say, because I had a lot of people, because I had Invisalign when I first met you. A lot of people said, oh, don't bother, because you'll start having it for months on end. Like, it just gets longer and longer and longer.
But if someone knows what they're doing with it, it's all
Right.
just like who you're seeing. It's definitely true. We do see a lot of people say, oh, but the Invisalign down the road is like £1,000 cheaper. It's like, well, fine. But
Go there then.
that isn't the thing that gives you the outcome. You can spend a bit less and then have someone who's less experienced and then take ages over it. But what's an extra 6 months, 12 months of treatment and maybe not an outcome worth? £1,000? Yeah, probably.
So say you were going to have, the braces on under the back of the teeth.
I had those.
Did you? Is that more effective than Invisalign if you want something done
I
quicker?
had them on the back of my teeth.
Yeah.
It was the worst thing I've ever had in my whole life.
What do you mean?
My entire mouth was like cut. My tongue was cut like for a whole year. Every time I would talk, it literally just, I'd be like, it was honestly unbelievably painful. I'm sure people have had it and they like it, and I don't know how they manage that, because I just tell people not to have that.
Really?
Have Invisalign or have them on the front of the teeth. But even,
a bit steep as an adult having those.
We actually don't offer it because I can't.
Because it was that bad. Wait, when did you have it done though?
I had it done. I was like 23. Had it redone. So I had braces, and then I had braces. Then it didn't. It just like was awful. Then I had them taken off, and then I had proper ones. And in my mid-20s, that was really cool. I had like elastic bands and everything. I was 25.
So on the side ones, bright coloured ones. Is there a limit to how white I can whiten my natural teeth?
Yes.
We answered that one. What are the regulations of dentists to look out for when I'm searching for a dentist?
So I think in the UK, like, everyone's regulated. So, that's hopefully
it's
fine.
different to cosmetic surgery, isn't it? Or is it the same?
So in dentistry, there's specialties. You can be a specialist. There's no specialism that exists for cosmetic dentistry.
Right.
So you just have to look for, like I say, reputation, results, credentials. Also, if you feel connected to that person, it's really about that. The place has got to have a method, a way of working that resonates with you.
Okay.
And you've got to connect with that person. I think, look, if I'd come onto your podcast and you were like, yeah, okay, what you're saying is good, but I don't really like him very much, then you probably wouldn't have come in.
That's true.
But then you said, I want to come in. And that's also part of it.
Yeah. Where can everyone find you? What's your Instagram?
At dr.samjethwa, and on Liv's page, have a look
on
at
my
her video.
page. Also, I highly recommend, if anyone actually wants to get their teeth done, I would say it's worth every penny, to be totally honest, because now I won't be needing any more other dodgy bits done to my face because I feel like they're perfect.
And we're called Bespoke Smile. Our method is the Bespoke Smile method. We're the founders of Feather Veneers, and in Wimpole Street, Marylebone, and Marlow, Buckinghamshire.
Thank you very much for that, Dr. Sam.